What's up, everybody? This is Brown Sugar Confessions. You know by now, it is Wednesday night on Power 1017. And we are so excited for tonight's show. You are not going to believe that we've got an amazing co-host with us tonight, a gorgeous man from Georgetown. We're so excited that he's here. He's lucky he's sitting not in our office right now, but we're so excited that he's here. And we're going to have a fun show talking about some things that I know that you listeners want to talk about. So let's just jump right into tonight's show. So, Treese, you are back.
Yay!
How was your vacation?
It was awesome. I cried. I had so much fun. Look, I did not want to get back off the plane when I stepped foot here and it was cold and rainy. I was tempted to just tell my dudes, give me another plane ticket. I'm out. I don't live here anymore. This is not my home. Mail my kids to me. Mail my cats to me. I'm out.
Not mail the kids and the cats.
But wait a minute. Wait. There was a word that you said, and I'm going to go back. You said my dudes. Was there more than one man you went away with?
Yes.
Confess.
I went away with my partners and it was a lot of fun. It was the first time we've gone on vacation all together.
Oh,
yeah. I have so many questions.
But it was so much
time.
Yeah, it was fun. We had a lot of fun. I stayed at some very fancy places and had private exclusive dinners and private tours. And it was awesome. Y'all know how I don't like people that much around me, especially now in the great panini. So it helped even more that everything was private and it was just for me. They spoiled me rotten is what I'm going to say. Rotten, just rotten.
Miss T, what's up with you, beautiful?
I mean, at this point, I'm just trying to stay awake. I had a very busy day. If y'all don't know, in one of my other jobs, I am a yoga instructor here in Atlanta. And it seemed like today, everybody wanted to come to class. And normally, if there's not that many people, I can cancel, get some extra sleep. No, everybody decided they want yoga today. I'm here for it, though. I'm here for it though.
All right. So we're missing KD tonight. She's out and about doing her KD thing. And in her place, or with her tonight, I should say in her place, we have a very special co-host with us tonight. Ooh. Now, if you're on YouTube, and you better be on YouTube at Brown Sugar Confessions. Okay, that's we're everywhere. Brown Sugar Confessions. Like and subscribe to it. You're going to see this very handsome doctor down here. Dr. Henry Childers, what is up? How are you? Woo-hoo! You're in the house.
Well, great on a radio talk show, but it's good to be here. And I'm disappointed I missed you today at the office. I was just doing all my other things.
I know. I was looking for you because I wanted to tease you a little bit. I am so excited that you are here. So let me give you a bit information about Doc Henry, and we're going to jump into what we're going to talk about tonight. So as you know, we've been talking all month long about Kinktober. We've been talking BDSM, fetishes, all those wonderful kinks. But tonight we're going to go to the science of sex. And so none other than to talk to Dr. Henry from Integrative Medicine in Georgetown about the O shots and the P shot. So, Doc Henry, tell everyone a little bit about yourself. What you do, where you're from, all that good stuff.
I'm a surgeon. I'm actually a general surgeon, and I trained in cardiothoracic surgery at University of Pennsylvania.
Wow.
And my background is cell biology. And I practiced for a long time doing open heart surgery and then lung surgery for cancer and for various diseases. Because my passion has always been cell biology and how the systems work and how biology works, I've graduated into that at this point exclusively. And really what it means is optimizing biology. And as everyone
I like that.
knows, after 20 or after 25, everything starts to decline, which is quote unquote normal. That's normally what happens. But what we try to do is optimize all of these systems to be more similar to what you were like when you were 20 by replacing different things and stimulating different pathways. And it has everything to do with general health. So we treat disease, we treat wellness, but also as far as what we're talking about tonight, it's sexual health too, because when you're young, you have certain systems that are working optimally. And as you get older, they start to decline. How can you recreate the system that you had when you were younger? And that's really what it's about. It's done in a natural biologic way, meaning it's not pharmaceuticals, it's not drugs, it's not all of these things, but it's really kind of changing systems and getting systems back to performing like they did when you were younger. And
right.
You know, you're as good as your DNA. You're not going to be better than that, but you can certainly be closer to that model than you will be as you get, you know, with every decade that passes, as everyone knows, things start to decline. Want to optimize those, and then you'll be better, healthier. The trajectory of your health span will change if you do all of that.
Exactly. I love the word that you use, optimize. Now, I've taken that word because I've used it many times on the show since I heard you start saying it to me, like Doc Val, I'm get you optimized. And I just like own that word because I'm like, ooh, I tell my husband, I'm going to be optimized tonight. So, get ready. But I really love that word. And many people don't understand that sexual health it's not a new frontier, but it's an expanding frontier in our medical community that I don't think a lot of people are aware of, that there are things that can optimize them around their sexual health and sexual wellness from physicians such as yourself.
Yeah, that's true. And one of the big problems, I think, with medicine today is you're told that, well, that's normal. That's normal happens. And a great example is hormones. As you get older, hormones start to decrease.
Right.
And you go to the doctor and you have all these symptoms and they do, 2 labs and they come out normal because they always come out normal, no matter how old they are. There are a CBC, which is blood counts, and the chemistry. They're always normal. They say, no, you're fine. Your labs are normal, only the labs that they got. And so go home. And even though you feel bad, go home because you're normal. In the case of hormones, for example, which is a great example, they decrease with age. Your doctor may say, well, that's normal and you're getting older. And he's telling you the truth. It is normal for them to decrease and you are getting older. That's why you're in the office, because obviously you're still alive, you're getting older. But because it's normal, that's normally what happens. It's normal to wither and die. It's normal for hormones to decrease. When they do, you'll have symptoms, which is why people get treated. But more importantly, the biology changes because all these hormones are so significant in multiple biochemical interactions. That's normal. It's not good. It's tragic.
Right.
So you don't want to be normal. An 80-year-old, at 80, you're normal to be how old you are. But wouldn't you rather be optimal? Systems to be more like it was when you were 20 or 30? Isn't that better than being normal?
100%. But, I had a question for you. And we're going to talk tonight about the O shot and the P shot. And for those that follow the show, you know that I had the O shot done when I went to Dr. Henry's office a couple of months ago. And I actually had it videotaped by my husband, and we're going to talk about that a little later on. But tell the listeners, and we're going to talk about women first. Why would a woman, a lotus holder, and let me go back and ask this. No, I'm not going to ask that question yet. A lotus holder, a female, why would they want to get an O shot done? And what is an O shot? Explain that first.
Well, an O shot is where you take what's called PRP. It's platelet-rich plasma. So the way you acquire platelet-rich plasma is you take blood, you go through a series of techniques, double spin, to remove all of the red blood cells, because we don't need those, and a lot of the other immune cells in the plasma, and you want to concentrate platelets, which are rich in growth factors and cytokines and other signaling molecules. So you want to reduce that. And basically what you're doing from your blood volume, you're taking 10% or less of the total blood volume and preparing it in a way where you can isolate those cells that have all the growth factors.
Mhm,
Now,
mhm.
growth factors, as the name implies, what do? They stimulate growth of everything. So there are multiple growth factors within platelets and within your body. If you can concentrate those and put those into a particular area, what are you going to do? You're going to stimulate growth.
Mhm.
So when I did open heart surgery, you make a incision down the chest, sternotomy incision. I always use platelet-rich plasma on that site because I know it's going to heal better. And every operative site, I would always use that. And we use that for arthritic knees and various different things. When you use it for the O-shot, for example, you're placing this in those areas which are known for arousal, sensation. And what are you going to do? You are going to re-stimulate growth of not only vasculature, which is important for all of this, but also sensation. So you're going to have a more erogenous effect, something more similar to when you were young, 20 years old versus when you're 50 years old.
Mhm.
So wherever you're putting this is your biologic tissue in concentration. You're going to enhance all of that tissue. So what I do now, I'm at Delaware Integrative Medicine. This is in Georgetown, as you mentioned.
Mhm.
What we do is essentially practice cell biology. We're trying to optimize. And for sexual health for both men and for women, we can enhance and revascularize with growth factors, stimulate nerve function and sensitivity with growth factors. And that leads to a better, for women, a more of a sensation. It actually increases muscle tone and firmness. It decreases a lot of the symptoms that women typically have as they get older, dryness and various other things. And the equivalent we'll talk about later for men, it's going to increase people who have erectile dysfunction. You're increasing the vascular capacity of the, hang on one second, the eggplant. I have to refer to my cryptic notes.
We've trained them well, listeners.
So you will have something more similar to an erection when you're 20 than you do when you're older.
Got it.
That's essentially what it's doing. You're just reestablishing optimal cell biology and function and anatomy.
You make it sound so effortless, when you explain it, and it makes so much common sense. But I really think that a lot of people are not aware of this technology that can enhance their sex life as they mature. And a question I had for you, why would a woman choose to have this done? What symptoms would she have that would make her seek out a doctor such as yourself for this medical treatment?
Well, first of all, the technology that you refer to is actually millions of years worth of evolution. This is not new, this is biology.
Right.
We know how to concentrate it and apply it to certain areas, but this is not something new like, we think of high tech, a new computer chip or a drug, which has just been invented. This is using the body's capability to regenerate, using that to regenerate. So it's not a new technology. It's just concentrating those areas of what does the body do? It heals itself.
Right.
Especially when you're young. So you're just concentrating that to heal yourself. Women would use that. There's several reasons why we do this.
Okay.
Number one, older women have urinary incontinence. The main reasons is because there's a couple of reasons why you could have that, but you lose volume as you get older. Everything kind of declines, as we know. You use volume muscle between the anterior wall of the vagina and the urethra, so where you urinate. And when you lose volume there, that becomes lax. And then you can have incontinence. So if you inject into that area, which is right at the quote unquote G spot, that wasn't on my list of words, so I think I can use that one. What
you're good.
What you're doing there is you're stimulating that. So you're stimulating that erogenous zone,
right?
But also you're stimulating growth of tissue there. And when you would increase the growth of tissue, you have more tissue. You basically reacquire the amount of tissue in the anatomy that you had when you were younger. And that works very well for urinary incontinence if it's due to that prolapse. And there's other things that can contribute to urinary incontinence. But the other thing, if you, hang on one second, if you inject into the beans, which is the word I'm supposed to use,
We're so clinical here, Doc.
That is another erogenous zone. And if you're doing that, you're going to increase blood supply in size, but also sensation, because growth factors include nerve growth factors, vascular growth factors, endothelial growth factors, and all of these various things that stimulate tissue. Because tissues everywhere have most of the things that growth factors are going to work on. But the main thing is to understand vascular system goes to every cell in the body. If you have a healthy vascular system, then you're able to get to every cell and take all the substrate and the oxygen and nutrients and everything else to every cell. And as you get older, that starts to decline. And if it declines, then you're not going to have the nutrient to have an optimally functioning system. What we're doing is trying to acquire that.
Awesome. So you're in Delaware, you're in Georgetown, Delaware, and give us your address, give us your phone number so people can reach out to you.
So we're Delaware Integrative Medical Center, and we've been here for 10 plus years doing this extremely successfully. The address is 20930 DuPont Boulevard. So it's on DuPont Boulevard in Georgetown, right across from the PNC Bank. Everyone seems to know that. The telephone is 302-258-8853.
All right.
One other thing I want to add on to, because you're talking about if we're doing something like an O shot or anything we do, it's not simply doing an O shot. Because as you get older, so many things decline. So with every patient, and I'm not going to get into the list of comprehensive labs that we do, but we do things that we know as you get older will be reduced. I mentioned earlier, you go to your doctor, he's going to get a CBC and a chemistry. They're normal. They've always been normal. They'll always be normal for the most part. They don't give you much information. If you look for the things that we know are going to be reduced with age, then you have the opportunity to treat things and change the trajectory of your health. So, for example, when we're talking about O shots and sexual health, a very important thing is hormones. As you get older, your hormones decline.
Right.
That's normal. It's terrible.
It is.
Hormones back to where they were before. What does that do? Testosterone, estrogen, progesterone, libido, for example. So it's the spectrum of things it influences is cognitive effect, brain fog, chronic fatigue, sleep, mood, anxiety, depression, all of these things. Metabolism. I'm getting older. I'm working out more. I'm eating. My diet's great. I can't lose weight. Your metabolism is decreased. That's affected by low hormones. Muscle building, bone building. Testosterone builds muscle and bone. Women get osteoporosis. Men don't. Why do you think? Women run out of testosterone because they only have 10%. Men don't run out, but they go down at the same rate. If you replace testosterone, you're going to combat those things that a lack of testosterone will produce, like bone density. Big thing is libido. So for sexual health, what are you thinking about? You're thinking about libido. Part of that's psychological, a lot of that's physiological. The hormones affect both of those things. And when you do an O shot, what you're doing is you're stimulating those tissues to be more sensitive, more erogenous, to be larger. You're increasing size and anatomy back to what it used to be.
Right.
That's what works so well. So again, it's not like a new technology. It's just applying evolution in a way because we know things now and know how to apply it. But it's taking all of that and applying it to each individual to get an optimal performance.
I love it. I love it. And for those of you that don't know, I talked about my experience with Dr. Henry, and like I mentioned, we videotaped it, and we have it on one of our episodes. Go to YouTube at Brown Sugar Confessions, and you'll see me talk about it. But I will tell you personally that I'm optimized, Dr. Henry. My husband thanks you immensely. I'm highly optimized, and I felt so good. I mean, I think the response from me kicked in within 24 hours, 48 hours. I was like a kitten, like just purring around the house like meow, meow.
The best part about it is, and you have all these new fads, TV commercials about take this and take that.
Right.
This is biology. We know what biology is. This is just
Right.
applying biology. So there's no mysticism. There's no magic. We're just using essentially our evolution and applying those biochemical and those cell biologic principles to health.
Right.
So
Absolutely.
it's not something different. It's just it's optimizing.
Exactly. That's what I tell people. Don't be afraid of it. You'll feel amazing. This is something that's, as you mentioned, it's not new. It's been around, for a very long time. And for people to realize there are alternatives that will allow you to stay sexually active and sexually functioning, as you mature. And I will tell you from my personal experience with it, it was wonderful. I felt absolutely, and I still feel optimized. The release is stronger. My tissues, I feel, have regenerated themselves. I feel just very good. And the feedback that I've gotten from my clients is that they've noticed that their tissue inside has actually started to lubricate more. So there were so many great benefits. But I have to tell you this story, Doc Henry, that happened. So, my husband was there in the office with us when we videotaped it. And so we had family here, from Germany this whole week, right? So, we're showing the family, the pictures and everything, and he's projecting it on the TV. And so all of a sudden, there is my crotch on the screen. With your hand.
Not always good. It's not always good to have technology.
It's not always good with your hand and a needle. And he's so nervous because the family's all sitting there. And he's like, oh, they don't speak English. It's okay. And he's fumbling. He drops the phone. And for like more than 30 seconds, here's my just standing and staring at everyone's face. I was so
Doc.
It was such a true thing. And so my husband is saying, oh, that's not Val. Don't worry, that's not Val. It's somebody else. I'm like,
that
makes it worse.
Even worse.
That makes it worse.
Then who is it?
we all have questions now. Right. And answer them now.
Right now.
They're like, if it's not your hand on this, whose hand is this? And I'm like, oh, that's the doctor. And they're like, oh, what is he doing? I was mortified, Doc Henry, that my own vajayjay is on the TV screen in front of my in-laws.
It's a medical show. Just tell them it's a medical show.
Exactly. I thank God they couldn't speak English as I'm sweating and Gert's dropping his phone because he's so nervous. Oh my God, it was hysterical. But if you're listening to my voice out there, seriously, contact Doc Henry, contact his office. I'm going to have all of his information, all the links to him so that you can get the answers that you need. Get the answers to your questions that you have and go see them at this office. They do amazing work, great staff. Doc Henry and Nina are just amazing to work with. You will really
not to interrupt, but one of the really important things is, again, I mentioned earlier, you normally go to the doctor, you get 2 labs. They're always normal. You don't learn anything. If you look into those things that we know will be abnormal, then you have an opportunity to make a change.
Absolutely.
And if you're 20 years old, everything is as it should be as a 20-year-old. But as you get older, we know these things decline. If you can identify those things that are declining, whether it's for sexual health or anything else, and correct them, you're going to age better. There's no question.
Absolutely.
That's, again, biology applied.
Absolutely. So, I'm going to use that. We're going to hashtag that word, optimization. I know we got to go pay some bills, don't we all?
Yes, we do. Go freshen up your drinks, get your refreshments, go to the restroom, come right back because we're getting into this topic again. Welcome back to Brown Sugar Confessions on Power 1017. Hey, did you know that you can listen to us on Spotify? That's right. Go to Brown Sugar Confessions and listen to us while you're cleaning, cooking, laying in bed, just whatever, while you're working. Look, there's a lot of episodes up there, so you can literally get through like 4 work days listening to us. Isn't that awesome? If you want to see our beautiful faces, join us over on YouTube where you get to see extra shenanigans and you actually get to see our faces while we're cracking up laughing, which I think for me is probably the best part of the show.
For sure.
We want to stop and say thank you all for, we're going into like what, 13, 14 months, 16 months?
Yeah, we are.
We've been on here for a minute.
We have. Yeah.
Look, we wouldn't be doing this if it wasn't for you supporting and showing us love and writing into us. And we want to return that love to you by always creating amazing shows, having amazing guests, and stopping to remind you that you're special, you're loved, and we love you. Do you ever listen to us and think, I got a question? I know the person for you, Doc Val. If you have a question about your sexual health or you need an ear that is non-judgmental and really only wants the best for you, you need to reach out to Doc Val at Valerie@swancenter.com. Now get a pen and a paper because I'm going to spell it for you real quick. And I'm only doing this once because I love you. Valerie@swancenter.com. VALERIE@SWANCenter.com. That was an alphabet. And I love you.
Letters. It's a lot of letters, y'all.
But now, if you want to catch us and catch all our shenanigans, you can catch us on Facebook, Instagram, and you can go to Doc Val's TikTok page where the real magic happens. Get on over there, like, subscribe, and share. We love to hear from you. And if you want to send us a confession with or without anonymity, send it to brownsugarconfessions@gmail.com. Exactly how it's said, exactly how it's spelled. brownsugarconfessions@gmail.com. Now we're going to get into this P shot and O shot real quick. I want to know, can young women benefit from this? For those of us who may not have the great health care, how much does something like this actually cost?
Oh, good question.
So young women, who benefits? It depends on the individual because everybody is different. Young women usually are optimized, and how optimal can you be? That's determined by your DNA. You are who you are.
Mm-hmm.
Young women can optimize depending on symptoms they may be having. So if you don't have sensation, you do have dryness, laxity, or any of the typical symptoms that go along, then yes, obviously you can. Because we're just stimulating fortification of tissue, nerves for sensation, blood supply for, which helps in the whole eroticism, the feeling, the sensation. Mm-hmm. Some young women don't need it. I mean, when you're young, you're more optimal than when you get older. Mm-hmm. So it really depends on the individual. The processing fee of PRP is really where a lot of the cost comes in. We take your blood, we spin it down. Now, unfortunately, there are places who take it and they put it in the test tube and they'll separate blood and they'll try to pull out that section that's called the Buffy coat, which has all of the growth factors, platelets, cytokines, chemokines. And you're trying to do it that way. And it's a whole lot cheaper to do that, but you get a much inferior product. Mm. The way you need to do it to have an optimal result is what we call a double spin technique. Price typically is between, if it's a $400 thing, you're not getting anything. So right. Just avoid that. It's going to be between $1,500 and $2,200. I think our price is $1,600. I'm not positive. So I think it's that. So the reason why double spin is important is because we can isolate the mononucleocytes, part of the immune system, and the platelets with all of the growth factors. When you do that, then you have that rich biologic component, which stimulate all the things we're looking to do. Because if you don't do that, you have a much inferior product, and you're kind of getting the cells that cause inflammation and don't work as well, and you're diluting out the process. So it's important to do PRP with a double spin and the appropriate technique. It's important to know the way we do it also, it's not just coming in and getting an injection. Anyone can do that. You can spin blood, do it the right way, get good PRP, do an injection. If you don't do all the work before that, if you don't analyze the patient as an individual, what is their thyroid hormone? Most people have not had a comprehensive thyroid. What are their hormone levels? What is the vitamin D level? All of these things work in conjunction to give you an optimal outcome. So it's never, whether we're doing stem cells in a knee or we're doing sexual health, it's never just coming in and getting the injection. You're missing all of the other key components that will add to the benefit of this. We're trying to optimize total biology, and that includes the vascular system.
I love it.
So it becomes a little bit complicated.
So really, this is, for me in New York, if you go to an IV place and you get the top shebang of the IVs, I'm literally spending $600 to $700 for a really good IV. So it's not that much more expensive. It's not something that is unattainable. It just takes you a while to save up and do it if you're paying out of pocket.
Well, just let me interject, because when you say a really good IV, a really good IV is what is in it. So typically you're getting vitamin C, something we call a Myers cocktail. It has all the B vitamins and glutathione and vitamin C. So when you get a really good IV, let's call it a Myers cocktail, the recipe is the same no matter where you are. In New York, so I would assume that the O shot in New York may be twice that. I don't know. New York City is expensive. Everything is more expensive. Where we are, we try to keep costs as low as we can. And we want anyone being lower than us who is doing a quality job. But again, the key thing is it's not just the shot. The preliminary things you're doing to make sure all the other systems are optimized in the case of sexual wellness, especially hormones, because they play such an important part of libido, of energy level, of sexual health. So you optimize from that point of view, and you want to optimize with an O shot with all of the growth factors.
Absolutely. 100%.
Does that answer your question?
Yes, it does. Thank you.
I got a question.
Yes.
My question is, so I know that you got to take some blood, but how much blood am I giving up for this shot?
Yeah.
And how big
You're
is the
giving
needle?
The needle's really big, and it's
Yeah,
dull.
I ain't with it.
No, it's like an IV. It's like anytime you go to give blood. So the needle's the same thing. You go to LabCorp, they take blood. We take 60 cc's of blood, which is more than you'll give at LabCorp.
Okay.
And the reason why is because we're going to reduce that volume, and what we're going to keep is less than 10% of that. It's probably about 5 or 6%, because we want to get rid of all of the other stuff. The things we get rid of, that's good stuff, but we can't use it because it's going to dilute the effect. So give up blood, and don't think, oh, well, I'm going to give up 60 cc's of blood and that's going to have a negative effect. That's going to stimulate your bone marrow to make more blood. So that's actually good. So a lot of people it's like when you donate blood to the Red Cross, you're giving up several hundred cc's. That stimulates your bone marrow to make more blood. That's a healthy thing to do. So by giving up 60 cc's has no effect on anyone unless they have serious medical issues, in which case they wouldn't be doing this anyway. So the 60 cc's of blood will not affect you. But what it will do is give us the opportunity to get a heavily concentrated amount of growth factors, reduce the volume down to maybe 5% of the total volume, and use that to regenerate.
So everyone out there listening, make sure that you go check out the website, Delaware Integrative Medicine in Georgetown. Like I said, we're going to have all the links up there for him. Make an appointment. You will not be sorry. If you're listening to me right now, I'm telling you what, ladies, I've sent several clients there. The reports are this. I'm going to tell you, Henry, because I haven't given you an update on a couple of things that my clients have told me about it. Number one, they are so horny, just to put out there. They're wanting it all the time. And I can agree, it does make you like optimize. I'm ready to go. The second thing it does, I've noticed, and this is from an older lady that had it done, she noticed that she was lubricating more, and she was experiencing a lot of vaginal dryness. And she did not have to use lube. Now, I'm not saying don't, but this particular lady that I sent to Dr. Henry noticed that she didn't have to use lube. She was just naturally like a younger 30-year-old woman. And I had asked a question, and I had two ladies tell me that got this done, that said that they were able to experience female ejaculation getting this shot. And they're like, for that alone, It was worth it. My husband was all about that. They were so surprised because they hadn't done that since they were in their 20s. And this one lady she's 62 and she was able to experience female ejaculation. She's like, I am so happy. So, I'm telling you, ladies, go talk to them. They're a wonderful office, Delaware Integrative Medicine. Doc Henry, what's your phone number again? They can contact you.
It's 302-258-8853.
There you go. Get your questions answered. This is amazing. And they do a lot of other amazing treatments in the office and procedures. So do yourself a favor, go check it out, make an appointment. Henry, so let's talk about our men folk. We talked a lot about women because, for me, it is very important because normally you hear about men and Viagra and Cialis, and you don't really hear about women and sexual health, and guys have these pills. So let's talk about men and what they experience getting the P shot. So why would a guy get a P shot? And will it replace Viagra and Cialis? That's a question I have for you.
Typically, you're going to get a P shot if you're not, if you have a problem with erectile dysfunction. With men and with women, you have to understand, and I don't want to stop boring anybody with this, but the vascular system, as you older, starts to degenerate like everything else. Mm-hmm. So you ask yourself, how many 20-year-olds have high blood pressure? Basically none. How many have coronary artery disease? None. Why? Their vascular system is intact. The inner lining of the vascular system are endothelial cells. They're the ones that release nitric oxide. What nitric oxide does is causes vasodilation. So repairs the vascular system. So if you have shear pressure in the vessel or high pressure, it stimulates the release of nitric oxide, you dilate. Mm-hmm. You don't have high blood pressure because you dilate. What protects that whole system is something called a glycocalyx. It's a slimy layer on the inside of the endothelium, which protects it from everything, heavy metals and LDL and the lipids and everything else. But it also transduces information to the vessel wall, which causes the endothelium to release nitric oxide if you have high blood pressure or shear pressure, or if there's an injury, it helps to repair. So the glycocalyx, this protective layer, which disappears as we get older, it protects the endothelium and the vessel, and it gives information to the vessel so it can respond to heal or to dilate. As you get older, the glycocalyx diminishes. Mm-hmm. As the endothelium is exposed, it becomes injured. As it's exposed, it's producing less nitric oxide. It starts to dysfunction. As it gets injured, that's where you get vessel disease, coronary artery disease, heart attacks, and this sort of thing. Mm-hmm. That's one problem that everyone has. And unless you treat that, it's going to be ubiquitous in everything because blood vessels go to every cell in the body. Men and women both have this. So what's the effect? So we look for this and we treat this as a general wellness thing. So what is the effect on sexual health with men and women? But with men specifically, why do you have erectile dysfunction? Because the vascular system, there's two tubes in the eggplant that are called corpus callosum, and they dilate, and give you an erection. Right. When the vascular system starts to degenerate, you lose the ability to release nitric oxide, to dilate, and to hold that dilatation. It's kind of a vascular problem. What else causes erectile dysfunction? Diabetes, smoking, high blood pressure. So it's a lot of the aging things, but it kind of comes down to the vascular system. So what does Viagra do? It tries to increase nitric oxide to give you that erection. Mm-hmm. If you stimulate the corpus callosum, which is all of those tubes with the vessels and nerves and sensation and everything else, if you stimulate those with growth factors, PRP, what are you going to do? You're going to regenerate those tissues, those cells. So you're going to not only have new cells, but you're also going to be able to, some of the old sick cells, regenerate those. They will be able to produce their own nitric oxide. So what you're doing is, with growth factors, you're stimulating the return of older deranged cells in the vascular system and nerve cells, returning them to a more youthful condition. So what's the end result? You're going to have an erection more similar to when you were younger. So you're having a change. And again, this isn't new technology or anything else. You're using the body's ability to repair and recover to regenerate these tissues.
Mm-hmm.
It makes biologic sense. But again, for men, that's part of it. And so when you talk about what is the cost of a P shot, okay, it's $1,500. One thing we do is we have a consultation before, because it's not just coming in and getting a shot and going out. Boom, you're out. See you later. You have to evaluate the total biologic system. And we go in depth to everything. And we're looking for, no one's really had insulin resistance measured. And when you get the two labs, you don't have any of that stuff analyzed. You measure glucose. Okay. What's your insulin level? If it's low, fasting, fine. If it's high, like maybe 50% of the people, that's insulin resistance. That will have an effect. So we study these things because we want to change these things and get it back to normal. In men, what's the testosterone level? It's essential for, again, sleep, cognitive effects, chronic fatigue, mood stabilizing, building muscle, building bone, and libido and function. So if your testosterone low and you're just doing a P shot, then you're missing the big picture. So it's not, I'm not going to say it's complicated, but it's more comprehensive than just doing a shot. We know biologically that the P shot works. You're stimulating regrowth of those tissues that have degraded. But to really treat properly, it's a bigger picture than that. And that's why we do evaluation on everybody that comes in, because when you do that, it applies to every situation we're talking about.
I found, yeah, it makes a lot of sense. I get it. I know for my male clients that I've sent to you, that they have came back and reported that they have stronger erections and they have a stronger orgasm. And the refractory period goes down, that they can, begin to have intercourse instead of the next day, maybe within a couple of hours, for my men that are in their 60s. So they have seen immense benefits getting the P shot, in addition to having the pellet therapy that you do as well. Yeah. So talk a little bit about the pellets and what that is. I think that's fascinating. I get that from Doc Henry. I'm putting my stuff out there, y'all. I'm just
I was about to be confused because I was like, when did we get the pellets? I thought we were still on the P shot.
I know. I switched because I have pellets in the day, but we won't go there.
I almost don't like the term. It's hormone replacements.
I know. I shouldn't have said that. I was going to
that's what we do the same thing. We call it the pellet because it's like a grain of rice.
Yes.
It's a bioidentical hormone. In other words, it's the exact same molecule that you're trying to replace. So if you take estrogen, there's one molecule in the whole universe that looks like estrogen. If there's anything else out there that looks like estrogen, configuratively and chemically, then it's estrogen. If you replace what you're missing, estrogen, for example, with the same molecule, then you're going to increase your estrogen level. Now, as I said before, I'm going to use the example of women. You get older, you're menopausal, you're having hot flashes and all these symptoms. Your doctor's going to say, well, that's normal, which it is. That's normally what happens. And you're getting older, okay? Which is kind of a cop-out. That's normally what happens, but it's not optimal and it's tragic. Unfortunately, your doctor typically is going to give you Premarin or Primpro or one of these drugs, not estrogen,
right?
Which we know it causes cancer, stroke, death, heart disease, blood clots, etc. It's worth billions of dollars, but it's not estrogen and it has side effects. So what's the downside of replacing estrogen with estrogen? Nothing. Common sense dictates there can be no downside. So with hormone therapy, as your hormones decrease, you have side effects. And in women, it's testosterone as well as estrogen and progesterone. What you will benefit most from is optimizing or giving, supplementing somehow those hormone levels to get them back up to a level of, let's say, a 20-year-old. The reason why people come in for hormone therapy is because they have symptoms. The reason they should actually treat it is because of the biology that they stimulate. Because there is no hormone or anything in the body that does one thing. It works on multiple pathways with multiple other systems. Everything works. It's a symphony. All the instruments have to play together. You start dropping instruments out, you're not playing. You want to get everything optimized. So
what symptoms, say, Dr. Henry, what symptoms are they coming to you with? What are they telling you they're experiencing when they come to
There's
you?
there's a list, and it's, the common ones are sleep, and it's brain fog, and it's
Okay.
chronic fatigue, and it's no energy, and you have, I'm angry, I'm moody, I'm anxious. I go to the gym and I just can't, I'm working out as much as ever, and I'm eating well, I'm gaining weight, and I can't get fit. Osteoporosis in women, it's a classic. Women get osteoporosis because they don't make testosterone anymore. Testosterone builds muscle and bone. Men do not get osteoporosis because they have 10 times the testosterone. They both decrease at the same rate, but men may go from 1,000 to 200. They're still stimulating bone. Women go down to 0. They get osteoporosis. So the reason you want to replace these are for the biology. The reason why people actually do it is because they have symptoms. It doesn't matter why you're coming in, you want to have it optimized. But the typical all of those things and more. And if we replace the hormones to the levels that we're shooting, we test 5 weeks after to make sure we're at the level. Every symptom you have, which is due to the hormone depletion, will go away. If you have symptoms after treat, it's due to something else, because we've excluded the hormones as the cause because we haven't at the optimal level. This is one of the biggest things we do. And I don't think anybody who does it will ever, you can attest to this, but people will not stop doing it. And people are amazed. Even people who think they don't have symptoms. We've had guys come in saying, I didn't think I had symptoms. This is after we do it. They come back. It's like, my family says I'm nicer. I'm going to the gym. I'm like buff again. I'm all this stuff. I have energy. I can, they didn't even realize, because it's such a slow, gradual decline.
It is so true.
But it just makes sense that all of the systems, hormones included, where they are at a 20-year-old is probably optimal. And as it declines when you get older, that's probably not optimal. And if you can correct it back to the other level, you're going to function better. You're going to live longer. You're going to be healthier. This just makes sense. It's biology. The thing I like about it is it's not like I'm trying to sell a drug or anything else. This is just reacquiring biology.
That's it.
We know that it.
It's amazing how well these procedures work. And listen, everyone listening to me, go to the website right now. Check out Delaware Integrative Medicine in Georgetown. Doc Henry, tell me your phone number and the website address again one more time for everybody. I'm going to make sure I have all the links up.
The website is Delaware Integrative Medical Center.com, or actually just Google Delaware Integrative Medical Center or Delaware Integrative Medicine. And the phone number is 302-258-8853. I want to mention one other thing, because we were talking about P-Shot. And an important adjunct to doing all the comprehensive labs and optimizing everything and doing the P-Shot. And I didn't describe how we do that, but we do the same thing as far as collect PRP. We concentrate it and we put topical anesthesia on the eggplant, which it's not that sensitive anyway. The nuts are sensitive, but the eggplant is not really that tender. But we put topical anesthesia on it, and you do on each side 2-site injection, 1/3, 2/3 distance, and we put several cc's of PRP. It doesn't hurt. I can tell you that.
I heard that meant it didn't hurt. I was surprised.
No, it's not. I mean, it's probably less than an IV. That's how we do that. Now, what's important and the adjunct is after, there's a eggplant pump, if I should say that. What that does is it creates a vacuum of negative pressure, usually 5 millimeters of mercury, negative pressure. And what that does is it engorges the organ. And by doing that, you create microvascular injury within the corpus callosum and all those vessels. Anytime you have injury, stem cells go to that, all the repair cells go to that, and the PRP that we give you go to that to repair. And as you're repairing, you're plugging in different areas. And with this, not only does it enhance all of the growth factor function, but it actually increases size, mainly girth. So there is documented size increase, mostly girth, some length. But you're doing that. It's like if you rip pants and you put new fabric in where you ripped it, you have more size. And that's what it's doing. You're replacing, by creating microvascular injury with the vacuum, you have an area that you're going to stimulate and repair. Right. And this is why it's important to do this after for like 20 minutes, a day for, several weeks. and it really does benefit. So it's not one thing. It's not just the shot. It's all of these different things you do to get the best result.
Exactly. So out there, go get this done. You don't have to sit and suffer and be miserable and feel your relationship is declining and your sex life is declining, and get optimized. That's our new hashtag. So go check out Delaware Integrative Medicine in Georgetown. Again, I'll put all the links up. Doc Henry, I will tell you, you are a natural. Can you come back? Because we have more questions. I could do a whole other show on understanding more around what you do, because this is fascinating. Would you come back?
I'd love to come back.
Oh, we'd love to have you. And I guess Miss T's looking at me like we're out of time. We didn't even get to everything I wanted to get to, but I think Doc Henry did such an amazing job, like giving us all this information. And you know, us at Brown Sugar Confessions, we're here about teaching and educating and also entertaining you. And tonight, Dr. Henry dropped some magical nuggets around our sexual health. So Doc Henry, thank you for coming on. And for those that are listening to us, you know what we say out there in Radio Land. We want you to stay safe and we want you to play safe. We're going to see you next Wednesday, and we're Brown Sugar Confessions. Take care, guys. Bye-bye.
Thank you, guys. Thank you, guys.
Thanks for listening to another episode of Brown Sugar Confessions on Power 1017. Go to our Facebook, YouTube, and Instagram page at Brown Sugar Confessions to like, share, and follow. Stay safe and play safe. We'll see you next week. Bye for now.